And today I'm going to talk about how it affects us aging. So everyone wants to, live longer, but no one wants to get old. I mean, that is something which is, that's a paradox in Western culture where we actually want to live independently, live healthily, and live longer. But we really hate getting old and we hate getting sick. So what can we do from the gut perspective to help with healthy aging, help with your biological lifespan, which is your lifespan, which is full of health, wellness, and vitality. So the objectives of the talk are to talk about the aging epidemic, to talk about things about healthy and unhealthy aging. What are the markers? What happens to the gut microbiome as we age? Why is there a unique microbiome in centenarians? What is something called meta-inflammaging? How does that affect aging? What's the role of lipopolysaccharide, which is a very poisonous molecule to our systems? Then what are the good things that a bacteria make? Short-chain fatty acids, bile acids, what happens to them in aging? And then to the end, how do we heal the gut? And how do we help with living healthy lifestyles as we age? So this is a 2015 Time article, where this guy, basically talked about a diet, and he said it called a longevity diet. And he said he predicted this kid is going to live to 142 years old. Now, do we really want to live to 142 years old? Not yet. 2023, the average lifespan is 78 years. Well, it's better than 1900s, where the average lifespan was 39 years. But we are now going through this aging epidemic. And we know aging is an unrelenting, progressive decline in physiological function and the cell integrity over time, which leads to loss of functional tissue. And that is fragility. Fragility is not a word we want to hear, but this is age-related decline in your cellular functions, which can be manifest with disease like sarcopenia, diabetes, cardiovascular disease, bone loss, and again, cognitive decline and neurodegenerative disorders. We are estimating that by 2050, approximately 30% of European and US populations are going to have individuals greater than 65 years of age. This is going to be more than people who are less than 18 years of age. Majority of the population is going to be older. So this is something we cannot ignore, and we really need to focus on, therapies to change all this aging, unhealthy aging, and how can we live our lives healthier. So this slide basically shows that, with this aging epidemic, yes, places like Japan, which already have 30% of their population more than the age of 65, but these are wealthy countries, they can support those patients. But by 2050, if we are going to have 30% of the world population, the biggest impact would be on the middle income and the low income countries. What resources do they have to help support this aging epidemic? So again, the global population is aging faster. People in China and Japan are going to be, because they're more populous, we can see it's going to be almost 50% as numbers are going to climb. Half the population is going to be aged more than 65. And this again is a big, burden to our human resources in terms of managing healthcare. How are we going to be doing that with, neurodegenerative diseases like Alzheimer's, with cardiovascular diseases, with obesity? We have a lot of these inflammaging or these older age diseases that we're going to have to spend a lot of money trying to take care of people at that age. So this is like a beautiful picture. This is the blue zones in the world. Okinawa, Japan, Icaria, Greece, Sardinia, Italy, Nicoya, Costa Rica, Loma Linda. What do these places have in common? These people are smart people. They eat a lot of fiber. They stare at the blue ocean. They have healthy lifestyles. They go exercise. They have communities. They have social interactions. They have purpose and meaning in their life, which keeps them into healthy aging. So that's what we aspire for. We aspire for being like these centenarians. And we're going to talk about what happens to the microbiome in centenarians. Why do they have a unique microbiome, and how we at this age can make changes. And now I'm in my 60s, I definitely say, you know what, I feel the impact of aging. You know, I live in an area code, you know, which is 949, all the SAM calls, you know, the diet, the influence, the, you know, environment, all that stuff is affecting aging process. So, you know, where you live determines what you eat, and what you eat determines your microbiome diversity. So people in like Africa, there are certain, this graph is about populations in Africa and in Venezuela. You can see those are the people scattered all around. Their microbiome diversity is much more. These are the hunter-gatherers. They go and they hunt for their food. They have a lot of vegetables. They live a simple lifestyle. They often don't take antibiotics. They live close to nature. And we can see the diversity of the microbiome between Venezuela and Africa is not different. But the US with diversity, which is in the blue, you can see westernized diet, our population, you know, exposure, environmental exposures, all the toxic burden we have, and what we're putting in our system, it's created a microbiome which is very not diverse. And I'm going to talk later about what diversity is. So just a few, you know, nomenclatures. What is chronological age or lifespan? That is the age from birth to death. And it doesn't mean that chronological age or lifespan is always a healthy lifespan. So biological age, which reflects the cellular function, your physiological function, that is an independent correlator of longevity. So someone can be 60 years old, but they can have so many comorbidities that their biological age can be 80. So we want to have better biological age. We want to have better health spans. And health spans are the number of years lived in good health. So it doesn't matter, you know, what our lifespan is, what our chronological age is. We really want to focus on biological aging and interventions to change how our body ages and how it ages in a healthy manner. And obviously, frailty is what we don't want. Frailty is diminished physiological reserve. Your body is prone to infections, cancers, and all these metabolic diseases. So it is related to often immobility, inability to perform activities of daily living independently. So that's where we don't want to go. So, you know, there has been a lot of, magazine articles about, the last 20 years about the microbiome and how it affects health. But actually started like a century ago with this guy, Elie Metcalfe, who really said that there's leakage of autotoxins in people who are getting senile, and that the treatment he prescribed was fermented milk and a simple lifestyle. So this concept of like really diet and changing how you interact with people, how you live, how you decrease the stress in your life, this has been going on for almost centuries. Like this is not anything new. And yes, we've been talking about gut microbiome and different issues, but I think in terms of longevity, we need to start thinking about it. So these are the 12, hallmarks of aging. In 2023, they added 3 hallmarks, including gut dysbiosis, chronic inflammation, and macroautophagy. So as we're aging, our DNA in our cells is becoming unstable. There is something called telomere shortening, where the ends of the DNA, they're getting shortened up. There is epigenetic instability. There is methylation markers. All those are affected with aging. Ultimately, there's mitochondrial dysfunction. There's cellular senescence, or the cells get old. And then finally, there is stem cell exhaustion. In between, you have lack of nutrient sensing. The patients are not really, producing enough protein enzymes to digest or metabolize the protein they're eating. So that is affecting their integrity of their cells and their organs. So these are important hallmarks that we need to address individually to prevent this aging epidemic. So what happens to age-related decline? There is reduced, this is called immunosenescence. So they can be cellular senescence or aging of all the cells. But what really impacts aging is the immune system. If the immune system gets old and your naive T cells, which usually run in if there's an infection to help your body, they're no longer being formed, and you have these memory T cells which don't effectively work, then we're left in a stage of vulnerability. We have increased risk to infections. We don't respond to vaccines. cancer cells start overgrowing in our body. So these are senescence aging or immunosenescence that we really need to think about. And can we make any interventions to prevent this part of aging? Also, there's also thymic gland, which is like it's a vestigial gland, is more in childhood, but as we age, it gets smaller, but it still is involved in this regulation of your T cells in your body, making new T cells. That kind of also shrinks up. So there can be, later on, we're going to talk about certain peptides and things which we can use to prevent immunosenescence. So what's a microbiome? My favorite topic, focus and passion. It is basically this entire factory, which is inside us, of bacteria, viruses, fungi, archaea. They're sitting in our gut and they're actually working with us. They're not just sitting in our system and saying, okay, we're just sitting here. They're actually doing a symbiotic relationship with us. They're working to extract energy from nutrients. This is the function. They extract energy from nutrients. They produce vitamin B. They produce vitamin K. They help with the growth hormone regulation. They're important for cell growth and function. They produce this something called resistance to colonization. They prevent other bad bacteria from getting into our system and taking over. They help with immune tolerance, that our body, when we introduce different foods in a child, say, has tolerance to different food introduction. So they basically program our immune cells saying, hey, this is the difference between friend and foe. They help to do that. They metabolize xenobiotics. They metabolize drugs into a simpler form in our body. They communicate with the brain. The brain-gut axis, which I'm going to talk a little bit about, is really important in cognition, memory, mood, in progression to bad diseases. They influence the energy metabolism. They help us store fat or remove fat. So that's the function of the gut microbiome. And this is the gut microbiome axis, where what happens in the gut doesn't stay in the gut. The gut is like ground zero. It communicates with all your organs in your body, your liver, your brain. There's a gut-lung axis. There's a gut-bone axis. So it is ground zero, communicating with all the organs in the body. It affects the functionality through metabolites, like short-chain fatty acids, or it can be lipopolysaccharides, which are inflammatory metabolites. So it does it through different ways of metabolites in systemic circulation. But the importance, the health of the gut leads to preventing diseases in distant organs. So what is dysbiosis? It is an altered state of metabolism where these overgrowth of organisms of low virulence, they induce a disease state in the body. They alter how we absorb nutrients. They alter our immune response, this gut dysbiosis, or this fight of this bacteria in our gut. They affect how our immune system responds, how we eliminate, toxins in our blood, or even hormones. So it is, when your gut is not happy, it can have far-reaching effects. So what causes gut dysbiosis? Most common is ultra-processed food. What we put in affects our gut. We talked about that before. Where we live that determines our diet, and our diet determines our gut. So if you're eating the standard American diet full of, high carbohydrates, high fats, low in fiber, our gut microbiome is not going to be happy. If we're taking antibiotics, we're destroying the population of bacteria in the gut. If you're taking antacid medications like proton pump inhibitors, which reduce the acid in your stomach and make you vulnerable to all pathogens coming in, because acid in your stomach is the first defense against organism getting into your gut. Chronic constipation, if nothing is moving, then everything is stagnant and the microbiome is stagnant. Stress. Stress basically is a big factor in our lives. And we talk about stress, how it affects every system in our body. But basically, stress increases catecholamines. Catecholamines are your neurotransmitters, which help you in that fight and flight mode. They increase gram-negative bacteria in our gut, which is not what we want. Catecholamines stimulate anger and fear, stimulates Bacteroides fragilis, which for some part is helpful, but it can even cause sepsis. Stress suppresses all the good bacteria. So the good players in the gut, like Lactobacillus, Bifidobacterium, And your immune system, your secretory IgA, all of that is suppressed with stress. So every aspect of health in an individual is affected by the gut microbiome. You're prone to autoimmune diseases like multiple sclerosis, lupus, rheumatoid arthritis with gut dysbiosis, acne, rosacea on the skin, chronic long-term eczema. It can inflame your joints. Some people with leaky gut have increased inflammation. It can cause fatigue. It can cause cognitive dysfunction, stress, anxiety, all these mood dysfunctions. If the gut is not happy, the brain's not happy. It can increase risk of cardiovascular dysfunction. Metabolites like TMAO, which are produced from choline metabolism, adversely affect cardiovascular health. And then obviously it can cause gut-related diseases. We don't want to get inflammatory bowel disease. We don't want to have this waste box of IBS. We don't want to have functional dyspepsia. We don't want to have bloating. So in its own terrain, it definitely has a lot of adverse effects with dysbiosis. And then it is related to this rising epidemic of obesity, fatty liver. It all starts in the gut. There's a gut-liver axis. A lot of the microbiota in the gut, they affect your insulin sensitivity, and there's insulin resistance, which can cause obesity. So altering the gut microbiome, it might be another tool to help with this obesity epidemic. Fascinating, right? So aging and dysbiosis, what happens to the gut as we age? There is decreased something called alpha diversity, and I'm going to talk about that a little later, but it's the richness, the variety, like there are a variety of people in this room. So that goes down to 1 or 2 people, and they're not that abundant. The species are not that abundant. Now, obviously, it's related to some changes, and I'm going to talk about these changes. There's a decrease in the commensal bacteria. And commensal is the word which is from Latin derived, like sit on the table and we eat together. So commensal basically means these bacteria which are living in symbiosis with us, which are living in this happy state. They're providing us nutrients and they're doing the effective function. They're not harmful to us. They're actually helping our bodies work and be healthy. Those bacteria go down. And there's an increase in these frail bacteria, which are these inflammatory bacteria we don't want. But this is normal chronological aging. This is what happens in people as we age if you don't make interventions to change our biological age or improve our health span. So alpha diversity, again, we had showed the slides about the hunter-gatherers, how much diversity they had, and it is the new number of species, the variety of species we have in the gut, the richness and the abundance of those species. Beta diversity is a term which we use how the microbiome is different from another person. Now we know we share 99% of our genes, but to be honest, the microbiome is unique. What we have in us is based on ethnicity, where did we grow up, what food we ate, and we only share 20% of our genes. So working in the gut microbiome is a very unique project, and it's something which is personalized, and it has to be based on your individual microbiome. It cannot be working on a generic microbiome based upon ethnicity, race, all that stuff. There are too many factors which really affect the beta diversity of the microbiome. So this is another thing, the microbiome is a wealth management. So this is your financial portfolio in the gut. If you have a robust, healthy microbiome, then you can fight diseases. You can help with, absorbing nutrients better. So this is something this article which came out in Nature really talked about the importance of diverse microbiome in the gut. So we know with aging, a lot of things happen in the body. We lose our sense of smell. We lose our sense of taste. Maybe we lose our teeth. Maybe we don't eat that much fiber because we can't chew. Your digestive enzymes, your pancreatic enzymes, the hydrochloric acid in your stomach often gets low as we age. And this is a normal aging process, related thing. It's not something that we can change. There can be, we're living in nursing homes. We are going to the hospital. We are prone to more infections. We're getting drugs like antibiotics with a drop of a hat. We're on chronic PPIs, neuromodulators, all that stuff is something which affects your gut physiology with aging. And it's inevitable, the more years we live, we get inundated with different issues. and we go through different times which are hard, and we're exposed to all this stuff. But that cumulative stuff affects your biological lifespan. So there is replacement of the good bacteria with these inflammatory bacteria, and I call them the bullies in the gut, which basically produce all these inflammatory lipopolysaccharides and cytotoxins. They cause a cytokine storm, and they basically prevent the good ones from living. So it is really important that if people are not feeling well, they should have a gut microbiome assessment, which I do in my practice. I do a stool microbiome testing, and then we can compare and, or with different kind of interventions, get rid of these bullies which are overpowering the gut as we age. So with aging, there's a decrease in the mucus layer in the gut. So that mucus layer is basically an important, factor of maintaining gut integrity. So basically you have the lumen of the gut and you have the mucosal cells. So this is the first physical barrier that we have between the world and our internal cells. And the mucus layer, it forms this heavy, thick protection, which prevents bacteria, toxins, pathogens from getting into the gut. But age-related, there's decline in both healthy and unhealthy aging. There's something called core microbiota, and that is, as we age, we only have two species, Firmicutes and Bacteroides after childhood. Bacteroides, which are, I would say, those are the, front guard, or, if you have a football team, those are the heavy hitters. They kind of decrease with aging. And in healthy centenarians, you will see certain Bacteroides species are high. And these species, Bacteroides, is the pillars of our community in the gut. They help to produce mucus. They are helping in digestion. So we can see altering maybe the Bacteroides species to favorable species might be something how we can manipulate the gut microbiota. There is obviously increased inflammation with unhealthy aging, and that is not there with healthy aging. So we can see this is different phases of our life. When we start as kids and as we get older, what happens to the microbiome? So the first 3 years of the life is when we're under attack. All our diet tolerances, everything related to food develops in the first 3 years of our life. As a baby, how were you born? Was it a vaginal birth? Was it a C-section? With C-section, you're going to see like Staph aureus and other gram-negative bacteria, hospital-acquired bacteria. With vaginal births, you will see more healthier bacteria. Now, you feed the baby milk, you give them human oligosaccharides, which basically are broken down and feeds bacteria like Bifidobacterium. Bifidobacterium infantis is one of the best bacteria that a kid could get, and it thrives and it supports the growth of other bacteria. And now by the age of 3, you have food reintroduction. So the question is, what diversity of food did the kid have while you were growing up? Were you exposed to vegetables at all? Was that a difference? So again, the diversity of foods that were introduced at such a young age affect your entire lifespan. Your sanitation, was that 5-second rule applied? Did you ever eat food off the floor? Did you have a dog while you were growing up? So all that stuff changes. All those changes in the first 3 years are critical for, and I'm going to talk about stress, anxiety, irritable bowel, what happens to the rest of us. So that gut span, we're talking about the microbiome, it kind of after age 3, it remains relatively stable until you go into that 50, 60-year age group. Then the taxonomic diversity starts changing. And we talked about the lack of diversity and the increase of like the gram-negative species. So all that stuff starts happening at age 60. So we're relatively stable unless we have hospitalization or infections or antibiotics, it's relatively stable, but the taxonomic stability declines around 50 and 60, and then it continues as we age. So again, this is different species. You guys don't need to know all about that, but it's probably, if somebody wants to look them up, it'll show you the species between the fetus and elderly and the changes. So there's a study, and this came out in 2023, that longevity of the centenarians is reflected by a unique microbiome signature. So these are the people who are living to 107, 108. These super centenarians have this unique microbiome, which is actually similar to a youthful microbiome. So somehow they have done all these practices in their life, And we can see that, this study had like 1,575 people, 300 of them were centenarians, and these were ages between 20 to like 110. And it basically saw the microbiomes, and they said the youthful people and the centenarians, they have similar microbial species. So we aim to be youthful even if we're living longer. So what happens to the microbiome? The core microbiota, remember the Bacteroides, which were the powerhouse, that kind of shrinks except for certain species, and you require, and in centenarians, you acquire bacteria, and they're like, you'll ask me 4 bacteria which are seen in longevity: Akkermansia, Odorobacterium, Acylobacterium, Christencella, again, unique bacteria to older people. And so that's why any kind of gut microbiome therapies are to support the growth of these unique bacteria, which are found in older people, which produce unique metabolites. So basically, when these bacteria are functioning in the host, they ferment the fiber, they produce short-chain fatty acids, they break down polyphenols, they produce urolithin A, they produce indole phenol acetic acid. So they're creating a lot of these post-metabolites. These post-metabolites are actually like the working bees, the worker bees. They go around in the gut and they do a lot of functions with the microbiome itself, the microbiota don't do. So they're actually the people who are actually doing, functions in the body, including affecting permeability, gut-brain axis. So as we age, we acquire these subdominant species which are beneficial to us. So this is actually just a list of, like the changes in the microbiome. So something I want to talk about is meta-inflammaging. What is that? So meta-inflammation is something we see in middle-aged people. When you have caloric excess, when you have fat as a major source of your nutrients, the body kind of cells respond to that and they say, we don't like it. We're going to produce these interleukin-6. We're going to produce TNF alpha. That is called meta-inflammation seen in middle-aged adults, which is a precursor again for chronic disease. But along with that, if you have something called inflammaging, which is happening in your gut when you start hitting that age of 60, where you have low-grade inflammation and you're obese on top of it, and you haven't changed your diet, then you get this absolute gut on fire situation, this inflammatory havoc, which is basically called meta-inflammation plus inflammaging. It's called meta-inflammaging. So this is another slide which really talks about this. So we have now this like vicious cycle of altered gut microbiota, which are not really like sensing food correctly. They're fighting with each other. They're leading to this inflammaging process. This inflammaging process leads to decline in the immune cells. They're like, okay, we're fed up. The body's so inflamed. We just want to go into this quiescent mode where we don't have to do all the work. So now if you have immunosenescence, inflammaging, altered gut microbiota, that triangle leads to age-related decline in your functional tissues. There's high infection risk, there's poor vaccine response, there's frailty. So we want to break this cycle. So physiological aging is, there are certain markers. We follow TNF alpha, IL-6, IL-B, C-reactive proteins, serum amyloid, fibrinogen. These are markers that as a, gut physiologist, this is what I follow in elderly patients to see what their biological aging is. So again, inflammaging is related to a lot of these, diseases we don't want to have: macular degeneration, neurodegeneration, kidney disease. So in every organ of the body, this inflammaging, this meta-inflammaging, if it happens, it has far-reaching consequences. So this is a study about, like we lose muscle mass, and do we think it is related to our cellular immunity or inflammaging? So they did this study in mice, and they looked at these germ-free mice and these mice that had actual fecal microbiota transplantation. So in mice models, you can create an environment where the gut does not have any microbes. And then you take these other mice and you feed them with this fecal microbiota transfer. And we see that, there is a regular cellular immunity created by the microbiota. So we can't always say that, there's inflammation. We know that the innate immunity is dysfunctional. That's why we're having this meta-inflammaging, because actually microbiota are helping our bodies with everything, including muscle mass. So they're helping us metabolize, say, polyphenols and produce urolithin A. Urolithin A, which is from nuts, berries, that helps with decreasing your average mortality by 19%. So this is a molecule that we can use to tailor to alter the gut microbiota and to affect our aging process. And it also helps increase skeletal mass. So one of the manifestations of like this inflammation, the gut on fire, is something called a lipopolysaccharide storm, where these are like actually protein. These are part of the cell microbe cell walls in gram-negative bacteria. They leak into the gut, into the systemic inflammation. And then where do they go first? They go to the brain. So they cause something called metabolic endotoxemia. They cause destruction of your glial cells, microglial cells in the brain, which are actually the scavengers. They're the housekeeping part. They remove the dead cells from the brain and they help with nerve growth. So when this endotoxemia is happening, all that scavenging effects are gone. You're prone to amyloid deposition, like in Alzheimer's disease, or you're prone to dysfunction of your substantia nigra and Parkinson's disease. These diseases are intimately related, including multiple sclerosis, are intimately related with this lipopolysaccharide endotoxemia that is happening in the body. So another thing which happens in the body is something called leaky gut. So remember we talked about the barrier between us and the world, or the nutrients and the pathogens which we are eating. That is your intestinal lining, and that gets damaged as we start aging. The mucus layer gets damaged, the intraepithelial cells, which are your enterocytes, usually they have something like, imagine a picket fence. They have the slates, they're totally tightly bound. Now the slates start getting deranged and they become a little loose. Toxins start parading through the body. Foods that we normally shouldn't be able to tolerate, we don't tolerate. There is gluten. So here's the gluten epidemic where, we have hybridization of gluten in this country. And now it basically, in a setting of leaky gut, that gluten permeates through the body and it causes inflammation. So food allergies are on the rise. There is malnutrition. You're not absorbing your nutrients because the gut is so leaky that the nutrients are like, goodbye. We don't want to even go into the system because there's so much of a fight. That's a dysbiosis going on. There's a toxin overload. Things which cause leaky gut, stress is obviously a big thing. Again, the standard American diet. Sometimes mold toxins can do this. Lectins can do this. Infections can do this. So low stomach acid can do this. Marker of leaky gut that I study is something called zonulin, something that a biomarker I can follow. And people who have a high zonulin are often inflamed. They often have food allergies. They often have, toxin overload. So something that I can bring down by healing that leaky gut or leaky intestinal barrier. So zonulin levels and lipopolysaccharides. So zonulin is a marker of leaky gut. Lipopolysaccharides is a measure of this gut on fire or the storm in your gut. All these levels are low in centenarians. There's actually a study in 2018 where they looked at the gut microbiome of young people having a heart attack, and they looked at these markers of zonulin and lipopolysaccharides and compared them to the centenarians, and they found the young people actually had higher levels of zonulin when they were under stress. They had lipopolysaccharides elevation, but the super centenarians had this resilient gut, which really did not get affected with all these issues. So, that's where we are aiming to go. So this is, again, a diagram of, the tight junctions. We talked about the picket fence, the slates, where in a compromised tight junction, which is on your right side, we can see there's food sensitivities, there's reduced nutrient absorption, because this barrier is no longer, those tight junctions don't exist. And when they don't exist, things start doing paracellular transport, and they don't go in between the cells, and they go into the body and they cause inflammation. So then another thing that we really need to focus about, and what we're all worried about, is about aging and how it affects our memory and brain fog. And, what are we going to do if you get something like Alzheimer's? We don't want to be dependent on, our kids for that. We don't want to be dependent on the healthcare system. So gut-brain axis now comes in, and it plays a very important role. The blood-brain barrier is a neurovascular barrier, and it's very permeable. If there are issues in the gut, it communicates to the brain with the vagal nerve endings. It produces neurotransmitters like serotonin, epinephrine, catecholamines, short chain fatty acids. These are also there, GABA. All these neurotransmitters send 80% of the information to the brain. Hey, the gut is not feeling good. Then the brain sends 20% of the information back to the gut, says, hey, this is the enzymes you need to produce, the physiology, the function, the motility. The brain helps to regulate that. So the gut-brain axis is one of the closest axes. And it's really important for us to pay attention because we don't want this axis to become gut inflammation axis, where there is disordered signaling from the gut to the brain and disordered signaling from the brain to the gut. This leads to something in the gut itself, which is called disorders of gut-brain axis, which are called functional disorders. And, there can be functional dyspepsia, irritable bowel, you can have postprandial epigastric pain syndrome, where basically there's nothing going on. Well, there's microbiome imbalance, but basically a general gastroenterologist is going to say, hey, calm the nerve endings down, use these neuromodulators. But the bottom line is it's a microbiome which is fighting, or leaky gut, which is cause of this like disorders which nobody can find a reason. But now there is a reason that we can work on to help these patients. So important thing to say, the importance of early gut microbiota changes in shaping later gut outcomes is emerging, where if you don't have a resilient gut microbiota when you were a kid, then later on you're prone to anxiety, depression, you're prone to irritable bowel syndrome. So this states the importance of not giving antibiotics to the kids that often, not keeping them in a sterile environment, allowing them to engage in nature, physical activity, and have healthy bonding of their bodies with the environment, and their immune system tolerance has to develop with different foods, not just keeping them on the same foods, having increased diversity, and how that affects you later in life with a lot of these issues. So again, this is a slide about linking about neurotransmitters, serotonin, norepinephrine, dopamine, and how it can affect the ability to respond to stress. So then we talk about post-metabolites. Again, we talked about the microbiome itself, and now we talk about the metabolites they produce, or actually the magic molecules which do the actual work in the gut. Short-chain fatty acids are produced by fermentation of indigestible fibers and starches. They affect and we're going to talk separately about them, by bacterial synthesis of exopolysaccharides, which are found on the outer lining of the gut wall, and how these affect immunity and inflammation. Then we're going to talk about bile acids and what happens to that in centenarians. Polyamines like spermidine, putrescine, spermine, which are produced by breakdown of amines, and spermidine is known to be linked with longevity. So these are the interventions we can do to help with longevity by altering gut microbiome and its metabolites. So bile acids now are emerging as novel new markers of aging, where we can actually change the bile acids into the microbiota, actually deconjugate primary bile acids, which are produced by the liver. So they actually break them down into these things called secondary bile acids. And we can measure these secondary bile acids, especially the iso-LCA and the allo-LCA. And we see that in centenarians, these bile acids are in pretty high levels. They're associated with our immune system. They prevent C. diff infections. They prevent streptococcus infections. They help with our T helper cells. They reduce the T helper cells. They help the immune system by increasing the T regulatory cells. So again, a marker of aging which we can measure on the gut microbiome profile is these secondary bile acids. And our aim should be to get bacteria like Odorobacterium higher in our system so we can produce these secondary bile acids. We know with aging, there's reduction in the cytochrome function, there's a reduction of the diversity of the bacteria, so then they don't deconjugate the primary bile acids enough. But measuring secondary bile acids, which is done in gut microbiome testing, might be another marker for biological aging. So again, we talked about butyrate. I mean, I love butyrate. I can say, and I just can't help saying, I don't know what to say about butyrate. But it is the magic molecule in the gut. It does every function. It feeds the colonocytes. It produces a state of beta oxidation, which reduces the oxygen in the gut, and it stimulates the production of these obligate anaerobes and less facultative anaerobes, which are the ones which require more oxygen. So our gut is basically in the colon has very low oxygen. And so that's why 90% of the bacteria in the gut are these anaerobes, these unique bacteria, which are performing these unique functions. When we get oxygen in that system, we destroy those unique bacteria. And that's helped by this butyrate. It is anti-inflammatory. It basically is a histone deacetylase inhibitor. Histone deacetylase inhibitors prevents DNA damage. So this is a very important function, how it affects, it promotes brain-derived neurotropic factors in our brain. So we can take butyrate in the form of supplements, or we can help the bacteria, the Faecalibacterium, the Roseburia species, we can help grow them in our gut. So we can produce more butyrate, which really does all the function in the gut. So how do we effectively improve longevity? That's the million-dollar question. We want to stop that clock. We want to look at the person on the right, not the person on the left. So the limit of human lifespan is up to 120 years, not yet to 142, but 120 years. Average life expectancy right now, 2023, 20 was 78.4 years. Remember, 1900, it was only 39 years. So how can we change that with a systems biology approach? And we're going to talk a little bit about this later, but stress is one of the biggest factors we need to control. Then what we have the power in the hands, which is a big tool, is diet. And there's the role of fasting. So a good healthy diet full of fiber, polyphenols, and then there's fasting mimicking diets, and we're going to talk a little bit about that. And now the newest thing, and exercise, movement. Movement not for, performance, but movement for circulation, whether it's Tai Chi, it is sweeping the house, whether it's gardening, even activities of daily living, we need to have movement in our life. Too much exercise actually is detrimental to the system in aging because it produces that lipopolysaccharides in our body. And now the upcoming new things are the senolytic agents, agents which are senomorphic or senolytic, which help the body not decay. And so there are a lot of these supplements which are coming out, and there's a lot of debate about them, and we can talk about them in another time. There are gut peptides for homeostasis, and these peptides postpone the division and limit the human somatic cells. So that's another talk for another day. But these are the latest treatments which are coming, senolytic agents, senomorphic agents, and peptides to help with aging. So the systems biology approach, stress, regulating the thyroid hormone, regulating the female hormones. I mean, stress is central. We need to find modalities in our life to reduce stress, anxiety, fear, anger, wherever that stems for. We need to incorporate healthy meditating techniques. Even if you sit quietly and not think for something, we need to reduce the stress because it affects almost every organ in the body. Definitely manipulating the hormones, thyroid hormones, and female hormones as they age. Those are important systems biology approach. And main thing is to reduce this meta-inflammation or meta-inflammaging that I talked about before, that if we take the systems biology approach where stress is central node, we will reduce the aging of other organs. So again, this is like, we can take vitamins, minerals to sustain immune function. We can use pre-postbiotics to modify the gut microbiota. We can use senolytic agents. We can use senomorphic agents. All these reduce inflammaging immunosenescence. They reduce infection risk. They improve vaccination responses. And that is healthy aging. So there are different clocks. There is a biodiversity clock that we talked about. Remember, the diversity as we age gets less. There are not that many varieties of bacteria in our gut. There's a taxonomic clock where we need good bacteria like Akkermansia, Faecalibacterium. These are the good subdominant species. They are the markers that we see in centenarians. We want to get rid of bacteria like Campylobacter. These are pathogenic bacteria. We want to improve our functional clock, which is an epigenetic clock, and it's also a clock which is based upon your circadian rhythms. We want to align our bodies with getting up in the morning with sunlight, going to bed at the right time. Those are important factors. Methylation is an important factor. And then we can use metabolites to help change our biological clocks. And these are things like indole 3-acetic acid, which comes from polyphenols, and that targets the DNA and helps with DNA metabolism. Phaseolic acid, which is a fatty acid, and that also helps with microbiome diversity. So using things in our diet and different sources, whether it's supplements or dietary sources, to improve these post-metabolites. So again, there are no ads about broccoli, right? But because hey, nobody wants to see an ad on broccoli, but I cannot help stress the importance of diet. A diet which is rich in fermented foods, polyphenols, and there is something called Himalayan tartary buckwheat, which is one of the new, fads of to prevent aging, which is full of polyphenols, which one of my colleagues, Dr. Jeffrey Bland, he grows in his farm in upstate New York. So that's like a good, if people want to go for names, this is to think about a diverse plant forward based diet is most important, with moderate amount of protein and more unsaturated fats, and basically a Mediterranean diet. Even though we don't live in the Mediterranean, but incorporating that diet is associated with longevity. It is associated with improving our guts. So this is a study, a FI-FO study, or a fermented fiber study, which was done in 2021. It came out of Stanford, where they had 39 adults, and they fed them 20 grams of fiber, one arm, and the other arm was 6 servings of fermented foods, whether it was dairy or it was sauerkraut brine. And they studied how did that affect over a 10-week period? How did it affect the microbiome? And they found, it was a 10-week study, mind you, it was not a long study. They found that fermented foods were the ones which increased the diversity of the microbiome. They decreased 19 markers of inflammation in your gut. High fiber foods, however, if you're on a baseline low diversity and you add fiber, then sometimes your microbiome doesn't do well. And so people with high fiber food, if they had low diversity, they didn't respond as well as people who had a high diversity initially starting off, and then fiber was added. So again, this is a short-lived study. They only give 20 grams of fiber. We know we should be getting 40 grams of fiber. Hunter-gatherers get 100 grams of fiber. 10 to 15 grams of that should be soluble fiber. These people are only getting 3 grams of soluble fiber. So honestly, I think there was some skewed, information in the study, but still, it is really important to see that fermented foods, they would help with weight management. They lower the risk of diabetes. They lower the risk of cancer. They lower the risk of cardiovascular disease. So they are full of probiotics and symbiotics and postbiotics. And they are actually one healthy form of really helping improve that diversity of the gut microbiome and the functionality of the gut microbiome. Caution patients with SIBO or small intestinal bacterial overgrowth, which have overgrowth of bacteria, you have to take fermented foods under advisement. So longevity and fasting. Hey, how does that help? So it triggers autophagy. Autophagy is a process where the body cleans out the damaged cells. There's metabolic switching. After 8 to 10 hours of fasting, your body stops using glucose as a source of energy. It starts breaking down your brown fat, and it converts it to something called beige fat, which basically is more bioactive, and it produces these ketones, which are, healthier post-metabolites. They go to the brain, they help with brain health. They give us, they improve this sensitivity to insulin. They increase sirtuins, and those are longevity proteins. The restricted fasting can alter your gut-brain axis functions. There are 2 types of fasting. There's time-restricted feeding and fasting mimicking diet. Time-restricted is 8 hours of eating, 16 hours of fasting. Fasting mimicking diets are like maybe people will cycle 5 days a month where they'll go on a 500-calorie diet. They will have nuts, oils, legumes, polyunsaturated stuff, but they won't eat a lot of food. And so these are the 2 diets that are out there. I mean, obviously there's fasting, and really I don't recommend that. I mean, to me, all this stuff is good, but in the sense, yes, how is it good? It helps with brain health. It counteracts fatty liver. It maintains gut integrity. It increases this white fat to this beige fat. It reduces heart aging, helps with muscle fitness. But again, not something that is recommended to do. People go on these crazy, fads, and they do intermittent fasting almost every day. Well, that is something called hormeosis, or it stresses out the system. So physical activity is also this form of hormeosis, or moderate to low amount of stress in our bodies, and fasting mimics that. If you're doing intermittent fasting every day, that is detrimental to you. And there's a study which came out last year, 2024, from American Heart Association, studied 20,000 people, and they were like, oh no, 90% increased risk of cardiovascular disease. I think it still needs to pan out. We still need to work on it. I think intermittent fasting, if done in cognitive fashion, we're doing maybe 1 day a week or 5 days a month. We're not doing it every day. It still has its benefits towards aging. So what are the things we can do? We can use probiotics. What are these? These are microorganisms that contribute health benefits, and strain matters, species matters, not one all size fits all. So when I first started practice, I used to give a few. Now I've diversified my approach. I don't really give probiotics to a lot of people because you know what? Some of these probiotics can be histamine producing. And we already know we are dealing with this histamine mast cell activation syndrome. We don't want to give just generic probiotics to everyone. We want to give personalized probiotics, which are based upon their deficiencies in the microbiome, not just generic probiotics. Now, probiotics like Lactobacillus rhamnosus, great probiotic. Use an antibiotic, induce diarrhea. It helps the gut integrity. You have Bifidobacterium longum. It's a psychobiotic, and I'm going to talk a little bit about that. It helps support your brain health. So, and Saccharomyces boulardii is not really a bacteria. It's a yeast-based probiotic used for recovery for antibiotic-induced diarrhea. Really great probiotic. Love that. But again, I use these when needed and not all the time, not in patients with SIBO, not in patients with, say, histamine reactions. They're already having reactions. And some of these probiotics are high histamine producers. So then what answer we have? We have spore-based probiotics. And those are now up and coming, should be used in patients with SIBO, in patients with a fragile gut. They have something called Bacillus coagulans, Bacillus indicus, Bacillus casei, and all Bacillus subtilis. And these spore-based probiotics are actually helping with the immune system. They're preventing microbial colonization. They don't damage the gut. These are, shelf stable. They don't have to be refrigerated. They don't create too much of a mess or chaos in the already existing terrain of your gut. So these are up and coming. I use them a lot. Now, next gen probiotics, and there are two that I really want to talk about. One is Akkermansia. Akkermansia is a bacteria which lives in the mucus lining of our gut. And it does a lot. It degrades the mucus, but it produces the mucus. And that gut barrier, integrity is dependent on this bacteria. Now, sometimes I give people pasteurized Akkermansia. Actually, it's more effective than diet-based Akkermansia. But the point is this Akkermansia, if you just give a probiotic to a person, you don't give prebiotics, which I'm going to talk a little bit later, or foods which help the Akkermansia grow, like polyphenols, that Akkermansia is going to go shed in your stool. Now, this Akkermansia is great for metabolic health. It helps with insulin sensitivity. It actually reduces your carb intakes, improves early satiety. It helps with the gut barrier integrity, so you don't get autoimmune diseases. People with inflammatory bowel disease, autoimmune diseases have low levels of Akkermansia. This is one of the unique bacteria which is found in centenarians. It helps with immune signaling in the gut, talking to the cells. Don't rev up the bad cells, the T helper cells, the Th17 cells, help with the T regulatory cells. So it actually works with immune signaling and autoimmunity. It definitely has a role to play. The other one, which is a big player, is the Faecalibacterium. Now, Akkermansia is probably 1 to 4% of your microbiome, but this one is a heavy hitter. It is 20% of your microbiome. And this one produces those short-chain fatty acids, the things which create the magic molecules, which help us live longer, which feed our gut. So Faecalibacterium prausnitzii is a bacteria which is linked with, if it is low, people with inflammatory bowel disease, irritable bowel syndrome, obesity, colorectal cancers, dementia, dermatitis, those people have low levels of Fecalibacterium. Again, there's no probiotic for Fecalibacterium. So I tell people when I say low Fecalibacterium, you gotta eat fiber and polyphenols because there's no like supplement that you can take. But by using prebiotics, which help nourish this bacteria, we can change the levels in our gut. So then the new thing, psychobiotics. We actually can use probiotics which help neuronal function and to support the gut-brain axis. And yes, not everybody should be taking them. They should be taken under medical advisement, but Bifidobacterium longum decreases your stress response, improves your exercise and performance during stress. Lactobacillus helveticus and Bifidobacterium longum combination, again, reduces anxiety and stress, and there are few references at the bottom. So what are prebiotics? Prebiotics are actually, substrates which selectively used by the host microorganisms confer a health benefit. So they're undigestible fibers, starches like galacto-oligosaccharide, fructans, fructo-oligosaccharides, which are found in hickory root, Jerusalem artichoke, onions, garlic, bananas, all these things are these soluble fiber supplements which resist the stomach digestion. We can give them in food form or we can give them in supplement form. They are nourishment for the bacteria in the gut. So same way as we need carbohydrates, proteins, and fats, the gut bacteria need prebiotics. So then they can go produce their short chain fatty acids, they can modulate the immune system. So this is food for the bacteria. So in almost everyone that I see, I generally advise prebiotics. Sometimes if they have very microbiome which is not diverse, then I start with a low residue diet along with the prebiotics so they can tolerate the prebiotic better. And then postbiotics, I think we've talked a lot about the short chain fatty acids, the bacterial wall fragments, the enzymes, metabolites that are produced by fermentation of food that we're eating in our body and doing all the function that our gut needs to do. Now, what's the new compound where we really have to think about is polyphenols. This is the Mediterranean diet. So polyphenols are found in, your coffee, tea, berries, nuts, anything with color is the foods with color, and even red wine has polyphenols. These have strong antioxidant properties. They prevent cancers. And we talk about indole-3 acetic acid, which binds to the aryl hydrocarbon receptor, and it prevents DNA aging. So polyphenols feed that akkermansia. That akkermansia is totally dependent on polyphenols. These are large molecules which often our gut microbiome is required to break down because the body cannot absorb it. So having a healthy gut microbiome is going to help these compounds do all the actions, the anti-inflammatory, anti-cancer actions that we need our body to do. So this is a study about fecal microbiota transplant where they took the stool from like the old, mice and they put it into the young mice. And it's found that inflammation increases. And when they did the reverse, when they took the young mouse poop into the older mice, they stopped producing inflammation. So there is a role of fecal microbiota transplantation. We generally use it for C. diff infections. But up and coming research is for inflammatory bowel disease, metabolic diseases, aging is another one. But again, we need more data. How are they isolating this fecal microbiota transplant? What are the sanitization practices? We don't want infections. We don't know long-term, side effects of alteration of gut microbiota. How is that going to affect disease? We need more studies on this. But this is another tool to think about. So then we talk about movement and the microbiome, and at least 150 minutes of exercise with 2 days of weightlifting. This is important to get the microbiome diverse. Sedentary behavior is linked with reduced diversity, reduced metabolic function. So, and too much exercising, going at it 100%, is going to actually destroy your gut barrier, increase your lipopolysaccharide. And a brand new study hot off the press, January 20th, that just came out, was a variety of exercise. If you do different forms, yoga, tai chi, walking, running, variety of exercise improves the variety of your microbiome diversity. Then we talk about the environment. What are we exposed to? The soil is what contains the microbes. And now we know the soil has got glycophosphates, is destroying those spore-based bacteria. So again, the environment severely impacts the microbiome, our interactions with our animals. We get microbes from the animals. People living in the same house, even though they don't share the genetics, they share the common environment of food, they might have similar microbiomes. So gardening, hiking, outdoor activities are really important. So looking ahead, we need to understand the makeup of the microbes, how they play a role in health and longevity, tailored interventions at the level of pre, postbiotics and symbiotics, psychobiotics, and that, the idea to die young as late as possible is what we want, but let your age go old, but not your heart. So I just wanted to mention 14 things that Japanese are doing. And I really was impressed when I was reading this, because we know that Japanese already 30% of the people are living above the age of 65 already, even in this day and age. So they're doing something right. And it was all about, 80%, leaving 20% of your food in the plate when you're eating, adding miso to your food, having a good breakfast, even having rice, fish, and vegetables in the morning. Going into the garden, having movement, not for performance, but for, circulation. Maybe going into, the forest bathing, as they call it, interacting with nature, having practices like, taking a bath to calm your nervous system down before you go to bed, sleeping on a futon to improve the alignment of your body. And then your thought process about having meaning and purpose every day when you wake up. That is the secret to longevity. Thank you.
This is a question from online. The attendees, thank you very much for your seminar. How do you stop bad bacteria from proliferating, and does the gallbladder play a role in that gut correction?
Right. So bad bacteria, we can use, obviously we need to balance the bad bacteria. So we need to crowd out the bad bacteria by using maybe spore-based probiotics. So spore-based probiotics are going to crowd out the bad bacteria. We can use herbs, botanicals, berberine, oregano, cat's claw. We can use all those herbs over your seed to, give them a treatment plan based upon the virulence of these bad bacteria. The gallbladder is definitely, we talked about the bile acids. Gallbladder is basically the bag which stores the bile, and it releases that bile sporadically into the intestine to digest food based upon your fat content. If you have a dysfunctional gallbladder, then it's not releasing the bile, or if you have no gallbladder, all the bile is released in one big lump sum. People end up with having diarrhea, but it alters the balance of primary and secondary bile acids. And we already know secondary bile acids are the ones which fight the C. diff infection, the enterococcus infection. They're antimicrobial. They're found in centenarians. So yes, the gallbladder is a role.
I have a lot of mast cell activation patients, and they have difficulty tolerating fermented foods. I usually put them on like a low histamine diet. I try to find them a probiotic that is low histamine producing, but have you been able to increase the fermented foods in their diet?
So mast cell activation are going to have intolerance to fermented foods because they have this microbial imbalance. They're going to respond more to not generic fermented foods, which have lactobacillus bifidobacterium, but they're going to respond to maybe heat kill lactobacillus plantarum, spore-based probiotics. Lactobacillus plantarum actually has the D-amino oxidase enzyme to break down the histamine, which they're not able to do. These people have to be treated with a very precision, concise manner to alter their microbiome, because if you give them, like say Lactobacillus casei, vulgaris, which are high histamine producers, they're actually going to have more side effects.
Another question. When I'm looking for probiotics or prebiotics, it's hard to figure out which ones to get. What do you recommend, or what should we even look for?
So probiotics, again, I say be cautious, talk to your gastroenterologist about probiotics. Don't use them just, on a whim. I'm just taking a probiotic, because again, they can more harm you, more than they can benefit you. Prebiotics, I like lacto-oligosaccharides, which are found in milk. Those are used for anxiety. Fructose oligosaccharides, and fructans, they're useful for constipation. So they help nourish a gut microbiome. Partially hydrolyzed guar gum, I use a lot of that. That is definitely used for IBS and constipation in SIBO patients. Then you have non-digestible starches like citrus pectin, potato starch. These can be used again, randomly. But remember, if you're sensitive to prebiotic fiber, then your microbiome does not have diversity. So again, with prebiotics, be cautious. I mean, I always look at the diversity of the microbiome, and I actually put people on a low residue diet, and I slowly ramp up on the prebiotics. Yes.
Question. I recently started working for UCI Health Hospital, and in my old job, most patients on antibiotics were on probiotics, lactobacillus, as you were saying. And I noticed that UCI Health patients are not on this probiotics. And it sounds like you're saying you have to be careful about starting patients on probiotics. Right. But all the patients in the ICU are on protonics or some kind of PPIs, because it's the bundle. And a lot of them are NPO for a long time, and they're all broad spectrum antibiotics. So I'm wondering, as of now with the studies, is it more recommended to start probiotics?
So again, it depends. Like ICU patients, they have leaky gut, they're immune compromised. To start them on probiotics get-go would not be a good idea. Often they're not eating, they're in ICU, they're getting fed through tubes and stuff like that. And, we don't know if what is happening to their systemic inflammation. So we don't want to stir the pot. But I believe in using spore-based probiotics for especially with people with antibiotics. And it's not just for the duration of the antibiotics, but maybe 4 to 6 weeks later, keeping them on like spore-based probiotics or Bifidobacterium longum, basically geared towards antibiotic related issues.
So it's probably better to address those things after discharge.
Right. But we don't want to stir the pot when they're that sick. Okay.
Thank you so much, Dr. Sachdev, for that very informative talk. I just want to thank everyone in the audience here.
Coming on this rainy day to come and see me.
And online. I just also want to make a quick announcement that we do have Women's Wellness Day coming up in May, early May. So if you go to our website, you can also find out more information about that. Thank you so much.